All right. Well, thank you so much for having me. I'm really happy to be here. I'm representing the Copenhagen group, and I will discuss or briefly talk about our latest clinical trial. I don't see the slides, they're out there. Based on fractional rate of frequency and a combination with tretinoin cream. Should I just click like this? All right. I have no personal disclosures, but we did receive the study device from the manufacturer. So just to get you started, when we first had this device in our hands, we wanted to explore its full potential and especially its ability to enhance topical uptake. And we did this with a preclinical study where we had both ex vivo skin and in vivo skin. And look at this beautiful grid that we have. And when zooming in with confocal microscopy, you see this beautiful hole, and in comparison, the intact skin just below. But it gets better, because when you add fluorescent tracer dye, we saw a substantial increase in the uptake where we treated the skin. So we thought to ourselves, all right, it has the potential to combine treatments. What should we start with? Which clinical indication? What combination should we do? Why not start with something that's really challenging? Yes, that's what we're going to do. Striae albae, the mature striae, these white, pale, palpable dermal scars. The redness has faded, but the structural components are really good targets for treatment, but it's really hard to really get that well improved. As you all know, it has a really high prevalence, and while we do try to treat with a range of energy-based devices, a range of topicals, the lack of evidence-based treatment approaches is lacking. There is some evidence on retinoids, especially the high dose, but it is restricted rather by its the tolerability of the high dose, the 0.1%. So we took up the challenge and said, well, let's do a randomized controlled trial. Sorry. We did a within-patient design, so each patient provided 4 comparable areas with striae, and we randomized them for treatment with FRF alone, tretinoin alone, the combination of the two, and then we left one area as untreated control throughout the study. All patients received 3 sessions with the fractional device, 4 weeks apart, and then we added the tretinoin. Of course, we added it in session right into those beautiful holes we just saw before, but they also supplemented with tretinoin cream in between sessions, of course, only for the designated areas. We followed the patients until week 20, so that was 3 months after the last treatment. Just a quick overview of the patient group. We had 20 patients, 19 of them were women. It was younger women, they all had striae, but other than that, they were healthy and normal weight. We had different anatomical regions represented, but most of them were on the abdomen. And for outcome measures, we really wanted to both have the subjective and the objective measures. So we used the Patient Observer Scar Assessment Scale, the POSAS, and then I will also show a few images from both clinical and 3D from some patients. So overall, on the POSAS, the patients, they really scored their striae as pretty severe. They were really unhappy with those at baseline. They were so unhappy that any medical attention we gave them seemed like it helped. You know these kind of patients. So they had a point reduction, all of them, but definitely the treatment gave a higher point reduction. That means a better improvement. And significantly, the combination treatment was much better than the control and the other treatments. For the blinded observer, at baseline it was less severe, or at least that's how the observer assessed these scars, you can say, and thus the point reduction was a little harder to get through. But for the combination treatment, again, it was a better point reduction, a better improvement, but it was very subtle. As you probably know, when we do clinical images of striae, it can be quite challenging. It's very light dependent, it's very angle dependent, and those structural components, the palpable components, can be really hard to capture. We did see a difference between the combination and the control in some patients, such as this one, and notice how you can almost feel it, but that the edges, it's less harsh. It's kind of erased in the borders of the striae for the combination, but then control, it's more or less the same. We did the same in 3D images that showed the same as well. Here we added a filter of depth of lesion. Here it's the more color, the brighter the yellow, the deeper the lesion. And again, as you can see, combination treatment, the follow-up compared to baseline was slightly better, but the control was more or less the same. So just to sum up, the combination treatment, we received really great feedback from the patients. They were happy altogether, but definitely more happy with the combination treatment, and they tolerated the combination really well as well. The objective findings were subtle, but they supported the results altogether. And I think this just shows that there's plenty of potential out there. We need to add more combination treatments or several treatments into our toolbox to really crack this nut that is striae. And I just want to finish by saying thanks to my team and thank you for your attention.